Hello and welcome to the Terp Family Fundamentals webinar series. My name is Kate Belney and I work in the Office of Parent and Family Affairs. For those who are new to our webinar series, we'd like to remind folks that it's intended to help you become informed consultants on campus resources. And we understand that your students are going to you for help in their decision making and when they're in the middle of tackling their problems. So at the end of this webinar, you'll see a list of over 20 different webinar topics that we plan to host throughout the year to help you be prepared as possible. So please visit our website, terpfamily.umd.edu, to register. If you remember our office's presentation during orientation, we like to say that during the normal course of events, there is no problem that can arise at the University of Maryland that can't be solved using the many resources available to your students here. So with that in mind, today we're joined by Laura Margaret Place from the University Health Center to learn more about how family members can help their Terp be successful at Maryland while in recovery. So thank you so much for joining us, Laura.
Thank you for having me.
Welcome. So we're excited to hear more from you and what we can remember to support our Terps.
Excellent. So like Kate said, my name is Laura Place. I'm a licensed clinical social worker, and I'm the coordinator for the Substance Use Intervention and Treatment Program at the University Health Center at the University of Maryland. And I have the pleasure of working with students who are experiencing problems with substance use all along the spectrum of difficulties that face students in terms of their substance use on campus. I want to talk today for sure about ways that parents can support their students in recovery, but we're also going to talk a little bit about some of the resources that are available and some of the strategies that you might be able to use when you're caring for a student who could be a little earlier in the process. Maybe they're experiencing more minor problems, maybe you're just starting to have concerns. That said, I think the most essential pieces to remember, and I'm going to say these are my top 5 things to remember when you're interacting with your student and there are concerns about their substance use on the table, or you're invested in helping them to recover, is that first, that students hear you. Even when students don't necessarily seem to be listening to you, the research indicates that students really do care what their parents tell them about substance use. A lot of parents will think, oh, well, if I tell my student I don't want them to drink, they're just going to do it anyway. But it turns out that of the people's opinions that they really weigh the most heavily, friends, professors, guidance counselors, that kind of thing, the voice that has the most weight with your students is going to be your voice. Even and perhaps most especially when they insist that it doesn't. Another important thing to remember in this process is that you're not alone, regardless of what level of difficulty your student is experiencing or has experienced related to substance use. There are other parents who have been through that particular challenge. There are professional clinical supports available. There are peer supports available for your students. There are supports available for their siblings. There are supports available for you. So this is not a process that you have to go through alone, either as a family or as individuals within that family. Third, a really important thing to remember is that recovery works. If we listen to media messaging, we'll have the impression that anyone who faces addiction is destined for a really negative outcome. And this is just not the case. Most people who experience problems with addiction or substance use difficulties that maybe don't quite reach the level of addiction, the vast majority of those people recover. And so the challenge is just trying to figure out how to get there as quickly and sanely as possible and to stay there. Another piece is that a lot of times families really need to heal together through this. Even if it's a sort of one-time incident where you're really concerned because perhaps your student has gone to the hospital after drinking too much, there's usually some conversations to be had as a family, and everybody has their own sort of reactions to that experience. Students may experience shame or embarrassment, and you are quite likely worried or angry or disappointed. And I think it's really valuable when families can to acknowledge that and acknowledge everybody's feelings and needs in those situations, and most especially if situations get more challenging or persistent, they last longer than that. And the last thing is really to celebrate recovery. A lot of times students who've been through the fires of facing addiction come out on the other end in early recovery, and they feel a really overwhelming obligation to do as well as they possibly can in all of their classes, and to take extra credits, and to just excel and impress people and make up for what's happened. And sometimes families can feel similarly as well. And it's really important to make space and time to appreciate and value what they've accomplished, and to appreciate and value yourself as a family and the things that you maybe used to enjoy but haven't dedicated as much time or resources to, if you've been having a difficult time facing addiction as a family. I've got some fast facts as well about the context that I work in. So I mentioned really quickly that I work in this office with this long name, the Substance Use Intervention and Treatment programs at the University Health Center. We call it that because we're really addressing a range of problems. We're not just addressing problems that are really on the serious end. We're also doing a certain amount of focused education and addressing problems early when students maybe have just gotten in trouble for something minor. With all of those different types of visits, we have about 1,800 visits per year. About 760 individual students sought services with us last year. Most of them come to us not necessarily by their own choice, referred by student conduct or resident life or their parents, but we also have a significant minority of students who are coming to us voluntarily because they're concerned about their own use. Even though there's a lot of conversation in the news about opioids or heroin and things like that, and marijuana or weed, the vast majority of students who are experiencing problems related to their substance use on campus are doing so with alcohol. So the vast majority of our diagnoses in the last year were alcohol-related diagnoses. And then stepping down a significant, a few steps down, you find students having problems with cannabis or marijuana. And then for all other drug-related diagnoses, so this is going to include students who may be having problems with things like study drugs or Xanax, which is a benzodiazepine. It's like an anti-anxiety medication. Basically, all of the other types of drugs that students might have had a diagnosis for having a problem with that in the last year came down to 13 students. And the vast majority of students who come to see us are experiencing a mild to moderate level of problems in terms of functioning as a student when they come to see us. I think a lot of times we have this sense that students only need counseling or could only benefit from counseling if they've quote unquote hit bottom or are experiencing a really significant problem, have failed out of school, that kind of thing. We are really here to help you and to help them address problems long before they become that serious and long before they have to make really dramatic changes in their life in order to be successful students and happy, healthy human beings.
Great. Well, I know there were a couple questions when we were coming up with this webinar that I wanted to field to you that we get from parents and family members, and I know that you hear from parents and family members for the good of the gander. So I think the first question I'll start with, Laura, is what supports are available either on or near campus to support students in recovery or who are working towards recovery from addiction?
So there is a lot, and that's really exciting because it's a bit of a change. I'm going to start with the core services that we've had for a while, which is going to be within the Substance Use Intervention and Treatment Program. We offer assessments for students who are experiencing problems, and those are the only people that we work with in a clinical context. The only people we're doing therapy with are going to be students. But then we also will do consultations with parents, the occasional concerned professor or academic advisor or a friend of someone. We offer a recovery support group, which is really for anybody who's working towards any type of positive change in their substance use or even maintaining a change in their substance use. For the last couple of years, we've also had what we've been calling the recovery drop-in space, and we're now calling the recovery lounge, which is meant to be just a safe, comfortable space. It's located on the ground floor of the health center. There's cozy couches and a couple there's blankets and throw pillows and a table where students can sit and work, and a bunch of outlets for students to charge their phones, because that's important. And that's it's really only open 9 to 5 Monday through Friday, but students really seem to value it, especially when sometimes places on campus that they might have been using to hang out or to study may no longer necessarily feel like a great place to be if they're making changes in their substance use. Also, on the newer side is a student organization. I like to think of it as a small but scrappy organization. It's really pretty revolutionary for a student in college to come out and say that they're in recovery, even to just a select group of peers. And so Terps for Recovery is a group that I'm really biased about because I'm their staff advisor. And their mission is to help support each other and any other student who is interested in pursuing recovery or actively in recovery at the university. We also have a new partnership with the Haven at College. They're opening a Haven at College Park outpatient center in maybe the end of October, and they are opening a sober housing option called the Haven at College Park Residence in just, I want to say, about a week or so. And that's going to be located in Terp and Row. So students who wanted to have a really supervised, sober living environment with a lot of support embedded in it, drug testing, breathalyzing, individual counseling visits, things like that, they would be able to still continue at the university or return to the university with that level of support. We also have an on-campus substance-free housing option, which is new. As of about a year ago, that does not have the same types of supports embedded in it that you would find as just part of the program at the Haven at College residence, but it's a really good option, and it happens to be in one of our lower cost dorms. And so far, that program is even just in its second year, and it's growing really quite quickly. This is something that a lot of students want to have, a space where they don't have to worry about disruption from other people's substance use.
That's fantastic. And it sounds like there are so many resources that students can kind of pick and choose what's going to be best for their recovery, which is amazing.
Absolutely.
Yeah.
Recovery needs to be personalized. A lot of times when people think recovery, they think just 12-step, and we do actually we're lucky enough to have one 12-step meeting that's located on campus in the university chapel. There's another one that's in the health center on Mondays, but that tends to mostly have older adults. But the chapel meeting on Thursdays, and that time could change. I don't know when someone might be listening to this webinar in the future. That chapel meeting and the Thursdays primarily attended by University of Maryland students and apparently some other college students in the area as well.
That's fantastic. So how would you kind of encourage parents and families to help prevent substance abuse problems?
So one of the best things that I can suggest, because we could just talk about this for an hour and a half, right? One of the first things I want to suggest then, and you'll find this in the presentation materials, is to go to the College Parents Matter website, because you can really get a lot more in depth on that website with specific strategies and conversation starters and things like that. But I think some straightforward tips to consider is, first to avoid glamorizing alcohol. A lot of times we use euphemisms, we try to say something sort of a little bit funny or a little bit silly to describe alcohol, saying that it's grown-up juice or framing it as being just for adults. But the problem with this is that for young people who are really just entering adulthood, this makes it sound like something that if they consume it, this makes them sort of automatically more of an adult. Although I think most people who spend any time with someone who's intoxicated could say that the reverse is quite possibly true. And it's also really important to set expectations about waiting to drink. I think a lot of us have this sense, I certainly really value this perspective that students need to learn to be responsible, and that they're going to make mistakes as they go along. But it's really important to encourage your student to wait to drink. Encouraging them to wait until they're 18 or 21 may not necessarily translate directly into them absolutely waiting to drink until they're 18 or 21. But what we see in really large studies is that parents who have communicated that expectation are more likely to have students who drink substantially less, who are less likely to get as intoxicated, who are less likely to drink as often. So it's really protective to encourage your student to wait to drink. And, there's a lot of questions that can come up around that. And again, the College Parents Matter website is a really solid place to get some strategies about how to handle some of the pitfalls of those conversations. Another important piece is to avoid ultimatums and to keep lines of communication open. I think this gets really challenging if your student has started to experience problems with their substance use. Or even if they've just started to drink or smoke weed or something like that, and you're not especially pleased with it. One of the strategies that seems to work really well is to agree ahead of time that should they ever be at a party and need to come home, that you will be willing to pick them up from whatever situation they're in, because this can help a student who may be wanting to avoid getting really drunk, or maybe is finding themselves in a situation where the person who is going to drive them home is drunk, or they may be offered a drug that they don't particularly feel comfortable using, but all of a sudden they're in an environment where everybody else is using it. So offering them an option that you will pick them up, no questions asked, at least that night, can make it easier for a student to make the decision to pick up the phone and call you and say, I really need to come home. Can you pick me up? And there's whole educational campaigns that sort of center around this as a strategy. It seems to really be effective. It doesn't mean you can't have that conversation the next day, but nobody's going to have those conversations well when it's 2:00 in the morning on a Saturday night.
No, I wouldn't imagine. That's not when I'm at my best. So how could a parent or family member tell when a student is starting to develop a problem, especially given how much identity development and change is already happening?
Oh, yeah.
Students, so what would be, maybe, I don't want to say signs, but how would they be able to tell if a problem is developing?
I always wish that I could hand over some kind of magical guide, where you could just check it off and then you could know for sure. But I think especially for most people who are responsible for the well-being of young adults in their life, they've known them for a pretty long time. And so what's normal for them. And if they make sudden changes to their habits or their mood, then this is something to pay attention to. It doesn't automatically mean that they're using drugs or alcohol. You don't want to necessarily make that assumption, but it is something that I think is important to bear in mind. There are also lots of websites where if you find something that you think is sort of odd or unusual in your child's room, you could Google is there for you. You can go online and there's actually another resource that's mentioned in the PowerPoint associated with this that can give you some more information about that too. It's the drugfreekids.org website has some materials for parents specifically helping you to understand what certain paraphernalia or other things that are associated with drug use could look like. But the other thing is that, a lot of times when parents are worried, it's because you smell something on their breath or on their clothes, or you find something in their room. And I think it's important to remember in that moment that not every single level of substance use is inherently the same level of problem. But if you find these two things paired, so this is really where you want to pay attention. If you start they're coming home late on weekends, they're smelling of alcohol. This seems to be happening more and more often, even if you've expressed that this is not something that you want them to be doing, and their grades are slipping and their mood is changing. Then when you get these things sort of converging together and happening at the same time, that's when I think you really want to kind of pay attention. And should your students' college friends ever tell you they think that there's a problem, I'm going to tell you right now, the problem is probably bigger than they have told you that it is, unless your student has particularly good doobie, super rule following friends in college. If their college friends are concerned about their use, then you should probably also be concerned about their use.
So how would you encourage a parent or guardian who has expressed that concern? Maybe they've seen all the things that you just outlined, and that they're confident that there's an issue, but their student isn't even thinking about their substance abuse. The student doesn't think there's a problem at all. Kind of what should be a parent or guardian's next step?
Yeah. So I think that, and this is a real challenge, it's easy for me to say this and harder for you to do this, but it's really important to just keep talking about it. Don't expect that one conversation or one ultimatum or one plan for one semester is going to cover this. The College Parents Matter website, as well as the drugfreekids.org website, have really great tips about how to have open-ended conversations. It can be useful to learn to ask what are called open-ended questions. So these are going to be questions that you can't respond to with just a no, or at least if you do, it sounds a bit silly. If you ask, how was school today? And someone says no. I mean, it's still easy for someone to just say fine to that. But if you ask, can you tell me more? Most people are not going to say no, even people who are really frustrated. So learning a little bit about how to ask questions that allow them to share with you what's really going on, and to ask yourself really carefully about whether or not you're making assumptions ahead of time about what's happening can be useful. It can also be really important to just go ahead and educate yourself so that you can educate your student about the fact that addiction and problems with substance use does not always look the same. And it often starts slow. Sometimes the analogy is like the analogy of a frog that doesn't hop out of a pot of boiling water because the temperature is increasing so slowly that it doesn't even notice. This can also happen when when kids are out playing in the cold. Their hands are getting colder and colder, but it's taking long enough that they're not even noticing. Then they come in and, they go to wash their hands or take a bath or something, and it feels like their fingers are on fire, right? So this is similar to what happens with addiction, that it can develop really slowly. And usually for young adults, for people in college, you're just starting to see the first signs of something that may not fully manifest until they're 30 or 40 or 50. So I think it's important to attend to it and start to break down some of those myths and start to become more knowledgeable as a family, so you can face that if things develop.
Great. So what would you say that, a student gets to the point where, the parent and family member has kept talking to them, those great conversations.
Totally.
And the student finally thinks that their substance abuse might be causing maybe occasional problems.
Yeah.
What would be the next steps for a parent or family member?
So again, this is going to sound familiar. You want to make sure that you just keep talking with them, that you use those open-ended questions, like we said, that you want to try to resist the temptation to open the conversation with giving them advice. Try to find out from them a little bit about what's going on. A lot of times for college students, their use hinges around their social environment. So if you can find out a little bit about like what's normal for their friends, not even necessarily starting off finding about what's normal for them. You know yourself best. This may not be a conversation that's easy for you to have, because it can tell you that if you express, really obvious shock or dismay or anger about what's normal for their friends, and that it's going to be very hard for you to not tell them, well, you can't be friends with them, then it may be that, that may be a sign to you that you already kind of want to bring someone else in, either the family member who always plays it cool, or a trusted advisor, a counselor, a spiritual advisor, somebody who can play that role of kind of keeping a more level head through those conversations. And they may even prefer to have a confidential conversation with someone who's not you, but be open to doing that if you're encouraging them to do so. It's also really important to be careful of the language that we're using. A lot of times, especially people who have history of addiction in their family are more likely to face addiction themselves. And so this can create really difficult situations for families around those conversations. If Uncle Jerry really, his life really went downhill, and maybe he's not really officially part of the family anymore because of his drinking, it may be tempting to say, oh, you don't want to be an alcoholic like Uncle Jerry, do you? But that type of language really just sort of reinforces two things. One, it reinforces this idea that all addiction looks the same and it always ends the same. And it also will mean that if your student does happen to already be drinking a little bit like the way that Uncle Jerry does, they are definitely not going to want to tell you the truth about what's going on. So this is a really challenging piece, is to try to use language more like talking about people who use drugs or students who use drugs, rather than referring to people as addicts or alcoholics. Similarly, I think it's better to try and use words like abstinence or not using, rather than talking about whether or not people who are clean or dirty and associating that with drug use or drug tests. And it's really important, especially for students, even for students who maybe ultimately will need to get sober. It's really important to consider acknowledging up front that not everyone who's experiencing problems with their substance use in college will have to get sober for the rest of their life, right? Because that could just be too much to take in for a college student.
At 18 or even 20, like that would just be overwhelming to think about the rest of your life.
Yeah, absolutely.
One particular way. Yeah.
And that's tricky, because this could be reality, right? You could you could have a real clear idea of what's going on with your student and think, substance use is just not going to work for you, buddy. But they're going to have a process. And people like clinicians in our office and at other places with professionals will be able to help them walk through that process of discovering that maybe this isn't working for them.
Well, then let's imagine that the student gets to that wonderful moment that we're all hoping for, when they want to address their substance abuse. They're asking for help.
Oh, yeah.
Where do parents and families go from there?
Yeah. And this is a key moment. And I think it's really important to recognize that this can happen and then disappear and then come back, because this is a natural part of the process of change. As we're considering change, especially big changes to our substance use or things like that, I'm sure that you've done made all kinds of changes in your life. You tried to change the way that you're eating, or the way that you're exercising, or how much TV you watch, or what you do as a family, and on weekends. And those types of changes just take time, and we kind of go back and forth. So it's really important to acknowledge that they may not stay in this state. However, while they're in this state, I would encourage you to find out from them what type of help they're willing to get, and to use all of your powers of love and affection and reinforcement to encourage them, and resource identification to encourage them to follow through on those things. You can as a good sort of conversation starter, I think it's really useful in that moment to find out from them what's making it a concern for them, instead of labeling their experience and, for instance, say, asking them if you think that they're addicted, or if they're an alcoholic, or asking them if they think they don't have any control over their use. I'd encourage you to ask them, what's making it such a concern for them right now? Is there something that's happened? What's going on? Would you be willing to tell me a little bit about it? If they say no, I don't really want to talk to you, who would you be willing to talk with? We could get you hooked up with a counselor, etc. And at this point in time in the process is also a really great moment for you to start thinking about reaching out for help as well.
So what if the student is willing to get treatment? What would you recommend?
You really just want to start with whatever kind of treatment they're willing to get. But if they're willing to get an assessment, either with the Substance Use Intervention and Treatment Office, or maybe, we have a lot of students from out of state, maybe it makes more sense for you to go to an independent licensed mental health professional in your area. There are people who can do comprehensive assessments around substance use and mental health. then I think that's a really good starting point. I would be a little bit cautious about getting an initial assessment with a specific program, because like an intensive outpatient treatment program or a residential based program, or what people usually think of as rehab, getting an assessment from there. Many of those programs are really responsible and reputable and will not recommend treatment that is unnecessary or excessive. But not all of them. And it's hard to know that as a consumer who's just, you're worried about your kid and you're trying to find a good place for them. So try to get an independent assessment if you can, or if that's not feasible, get assessments from at least a couple of different types of treatment programs so that you can compare and contrast and make a plan as a family.
And if they're unwilling to get treatment?
And if they're unwilling to get treatment, this is where I'm going to invoke the really sort of cheesy reminder that you want to put on your own oxygen mask first. And I would encourage them, again, to participate in whatever level of treatment they're willing to go to. Maybe there's someone in the family who is in recovery and they're willing to check out an AA meeting with them. Maybe they're willing to get, a couple of couples counseling sessions with their girlfriend or boyfriend or partner or whoever. Maybe they're willing to go to 2 family sessions, but no more than that. Do whatever they're willing to do as that starting point, but also make sure that you're starting to take care of yourself, build up some of your own base of support and skills. And although I generally avoid ultimatums, that's mostly because I find that parents want to set ultimatums in the hope that it will control their child's behavior when they're kind of getting out of control. But you always want to consider, will I really want to follow through, and will it really be good for them and for me and the family if I were to follow through on that ultimatum? And if it's not, then I'd encourage you to just resist the temptation to set that ultimatum. It is okay to set boundaries, and a really great idea actually at this point to start setting boundaries and explaining what the natural consequences will be of their behavior. If they've made it clear, or it's somehow become clear to you that their grades are slipping because of their use, and the only way that's really going to improve is if they cut way back or they stop using, if they promise that they're willing to get drug tested or something like that, then you need to be clear as a family about what are going to be the consequences. If you come back with, 2 more or 3 more F's or C's, or, a certain number of failed drug tests, what are we going to do next? Then at that point in time, we will expect you to go to treatment. Then at that point in time, we will expect you to see a counselor. Then at that point in time, we will expect you to live at home, whatever it is, and to have it be really clear up front so that the student has the opportunity to do what they're usually at that point going to be promising to do, which is to control things.
Well, I can imagine for a student, it would be incredibly difficult to be in college and also in recovery of some kind, particularly if it's an intensive treatment.
Oh, yeah.
So how can parents and families support their student while they are in treatment and trying to still be successful here on college?
Oh, yeah. I mean, it's a really difficult thing. This is sometimes college, and this is not the University of Maryland specifically. This is just college as an environment. Literature calls it an abstinence hostile environment, which is basically, you already probably naturally understand this. Being a student on campus who is not only just not drinking or using very often, but who is absolutely not using at all. This is a uniquely difficult place to be, to do that. And so they do really need support from you. I think one of the things to bear in mind, I mentioned earlier this temptation when things have not been going well and they start to get into recovery or they start to get into treatment to try to take on too much, like to make up for lost time. I'd encourage everyone as a family to try to resist that urge. Treatment takes time and effort, mental effort and emotional effort, and there are just only so many hours in a week. But once you've resisted that temptation, I think it's just really important to make sure that you're really clear on what types of treatment options exist, and that you understand what they're going to be doing in that program and what the time commitment is, so that you can help them, and maybe even work with their program to help them figure out what a better plan is for that semester. Do they need to take a break? This is something that's fairly straightforward at the university, and can be a really helpful part of treatment, or do they need to cut back on their course load for that semester? There are even specific methods of getting approval for a reduced course load. For instance, if somebody had a medical condition that interfered with their ability to function at the full course load that semester. For you, again, this brings out this is a really great time to make sure that you're really educated, that you seek out some of the supports available at drugfreekids.org. And I'm going to talk a little bit more about what some of those look like in a minute. Various levels of treatment that your student could probably continue attending campus with would be if they're doing something called an intensive outpatient treatment program. This is usually like 6 to 15 hours a week, depending on the program and the level they are in the program. There's going to be one of those opening nearby in fall 2018. A couple of others that are good programs nearby are going to be Colmac Outpatient Centers and the Maryland Addiction Recovery Centers, but those are going to be a little bit further afield from College Park. Most residential programs are not going to be compatible with staying in school. So the Haven at College's residential program is a really neat option there, because a student who's really committed to their recovery would be able to live there and attend treatment and go to school at the same time. But if a student really needed a super safe, controlled environment where they simply could not access any substances, then they would likely need to take a break from campus, and similarly for students who are experiencing symptoms of withdrawal resulting from not using a substance that their body has adapted to. This is particularly important for students who maybe say like, I can't stop using Xanax or benzos or alcohol, because the withdrawal process from those specific substances can actually be fatal if there isn't sufficient medical intervention or supervision. I also recommend that you work with them to help set up a plan of action, or encourage their care providers to help them set up a plan of action that includes at least 4 recovery-oriented activities a week. A couple of these should be explicitly focused on substance use. So like 12-step meetings, counseling, group therapy, the kinds of things that people I think usually think of when they think rehab and recovery. But a couple of them could be other things that are just really valuable for that student's recovery. Art, engaging in art or music, or enjoyable physical movement, yoga, dance, whatever.
Any other recommendations for how students can be supported while they're in recovery on campus?
I think, there's sort of a checklist that I go through whenever I talk with parents about this. One of the first is going to be to figure out your housing option. That's one of the things that really makes this such a difficult environment for people to be in recovery, especially in early recovery. We talked a little bit about some of the options that are going to be on campus. There's the substance-free housing option, but that's really, for someone who has a more solid, established recovery. There's the Haven at College. Even just sometimes it comes down to the details of who are the people in the house and what are they doing. So getting a sense well ahead of time of a student returning to campus, if they've taken a break, getting a sense well ahead of time of what the norms are in their friends group can be really helpful in making this plan. Also, as a family, it's really important to discuss in advance about how you want to handle relapses. Relapse is not something, this is always a difficult conversation. Relapse is not something that you really want, but it's also a really, really normal part of the process of recovery. So I encourage families and individuals who are in early recovery to simply expect that it will likely happen at some point, and then have that plan in place. What does it mean if this happens? Do you take a break? Do you go to another different type of treatment? What does it mean if it happens in 2 years? What if it means if it happens the first semester you're back? And then to make sure that they have someone that they can talk that through with, whether it's a counselor or a trusted advisor or a sponsor in a 12-step program, somebody they can talk that relapse through with so they can use that information to make a different decision later on. And then you want to encourage them to get connected with other students and other people who are in recovery. This is hard to do, period. And it's really, really hard to do if you feel like you're the only one or the only student who's going through this. Terps for Recovery is a great sort of place to identify other students in recovery. Some of the 12-step meetings and some other types of meetings in the area can be other great places to identify young people and students in recovery. And then for everybody, the challenge is to remember that treatment definitely doesn't end after 30, 60, or 90 days. It doesn't end after a semester. Substance use disorders are considered chronic, relapsing disorders, just like a lot of other things that we experience, whether it's diabetes or problems with, cardiovascular problems. You make some progress. Sometimes you lose some of that progress. You use what you learn to try and make better choices the next time. And they're really the options about what to do for this are mostly things that we've already talked about, some individual and group counseling options, 12-step community. Sometimes people find it really valuable to engage with their spiritual community. And this may or may not be the same specific religion or spiritual practice that you raise them in, but just being able to engage with that part of ourselves and to talk about things that are really meaningful to us. However we do that can be really important. And then as a family, you want to learn to have those more open conversations. Family therapy can be really useful. You can build some interpersonal skills, again, with the Drug-Free Kids resource that I'm going to talk about in just a minute. And I just continue to recognize the achievements that they're making by staying sober or staying in recovery or even working towards that, and acknowledge how difficult it is. As a sort of final tip, you don't want to disclose that your student has been dealing with addiction at Thanksgiving dinner with everybody around the table. You want to find out ahead of time how they feel about sharing this information and come to a plan together. So yeah, I think I also just want to sort of show you some of these links. We've got the link to and the image for one of the pages at College Parents Matter, which is collegeparentsmatter.org. This is a really great place to go if you're looking for information about how to prevent problems and how to intervene early on. There's a page with some resources. I didn't list the website for all of these, but they're really easy to find. If you Google AA or Karen Parent and Family Support Groups or the Maryland Addiction Recovery Center, or the Partnership for Drug-Free Kids, that one's really easy. That one's drugfree.org. Then you can find like a lot of different resources here depending on what is a good fit for you. If you want something in person, if you want something 12-step oriented. I really love the parent-to-parent phone coaching program that you can get from the Partnership for Drug-Free Kids. This is a free, evidence-based, rock-solid, logical sort of educational program where you also get to interact with another parent who has been there. They have walked the walk, they talk the talk, they have had the experience of having a child face problems with their addiction before. Sometimes their children are in recovery, sometimes they're still struggling, so they really know what it's like to be there. And again, it's free, it's over the phone, it's just a great thing to take advantage of. If you are more interested in reading a book, I really recommend the Beyond Addiction book. It's called Beyond Addiction, How Science and Kindness Help People Change. There's something like 4 authors, so I never remember off the top of my head all of the authors' names. But there's no other book with that same title, so if you find that, you'll be good to go. And this is a really nice book also because you don't have to read it cover to cover to get something useful out of it. You could pick up a copy of this online or in a bookstore and then just settle down to read one chapter at a time that seems relevant to your needs based on what you find in the table of contents. And then again, we've listed the on and near campus resources that we've talked about today.
Well, thank you so much for chatting with us this afternoon. I really appreciate hearing about all of the resources on campus and different ways parents and families can support their students in the recovery process. So as we bring this webinar to a close, I'd like to remind everybody that obviously a recording will be available on our Terp Family YouTube page, which you can access through our website, terpfamily.umd.edu. And on the screen in front of you, you'll see a list of future webinars. Maybe something stands out to you that you're interested in, please go to our website to register for those. And we look forward to connecting with you in the future. Thanks so much. Have a great
Thank
day.
you.